So in this video we're going to look at the Dermoscopy itself and also how to get the pictures from the camera into the consultation and from the consultation into the Word document to send off to dermatology, so everything is all set and good to go. Obviously this is extra work, so we need to make it as quick and efficient as possible. So let's just say we've got Mickey Mouse in front of us. He's worried about a mole, and so we need to take a picture. Make it easy, you need AccuRx in front of you, and then all we're going to do is just type in for Dermoscopy, and you'll see here there's a template that pops up, Dermoscopy in practice use only. This will then highlight, and I've blurred it out in the video, but when you're on the actual system itself, it will highlight the mobile phone number to send it to. So all we're going to do is just highlight all of that, hit copy, and then just paste it, because you want that text to go to the practice's mobile, not the patient's. Okay, and then in case you've got the box, I've got the pin for the mobile phone number there as well. For the purpose of this demonstration, I'm using my own phone, just so I can record it. So once we get the text message through, this will just take us to our phone here, and we click on the link to respond, and that will prompt us to input the patient's date of birth. And that should take us to this screen. So 1st of the 1st, 1945 for lovely Mickey Mouse. And then we come to this. We'll just need to put a couple of words in just to sort of get things moving. So put mole or sort of skin picture, and then put attach file and take photo. We can only access take photo only. And then what we're going to do initially is take an overall photo, and then the next bit we'll look at. So for our dermatoscope, we've got really three parts. We've got the actual device itself, our mobile phone, and then we've got this adapter, which means that we can clip this magnetically to the phone itself. You can remove this, okay, so it's just a screw mechanism, so you can unscrew it there, and if you do put it back on, just make sure that it's keeping the rear camera nice and clear so that you get a decent image from it. With regards to the dermatoscope, it's stored flat, so you can see here it's relatively flat there, but this means that when you try and get an image, it's going to be out of focus. So using this twist mechanism, okay, you can then move this in and out, and then that will change it from there. Button on the side is a lovely light, give you a nice shining light, and you can then set it for polarized, depending on which one, okay? And the advice is that you adjust between these light settings to get the best image. So as you can see here, I've got a picture of my mole. This is just on my forearm, just for purposes. Now, interestingly, I've actually got the camera not correctly mounted. As you can see in the bottom left-hand corner, that little black bit, that shows that we should readjust that little adjustment. But anyway, we'll carry on for demonstration purposes. So let's click on the dermatoscope just to get it nice and clear. And again, I've already adjusted the focus just to make sure that it's nice and clear from that point. As you can see, we're going on the lesion itself, or a little mole, lovely and normal, and then we're just going to tweak it until we get a nice crystal clear picture. And as you can see, it should start to come into focus too. What we can do as well is adjust the polarized light just to see if that will help things as well. So we're going to take 2 photos in total, and you need to do a separate attachment each time. I've only just done one in this demonstration. So we've now got our patient's, the picture that we've sent, and we're going to hit save to record. And that's that sorted. So if we go, before we do pull up the Word document, if we go onto our tab journal, and we can see that our attachment's now saved onto it. So we're going to right click on our JPEG and just put save file and just put it to our desktop. As you can see here, what we're looking at is this lesion diagnosis and management, where they want their tele-dermoscopy from that way. This form protection button, make sure it's unticked so that you can tick these boxes. For the purposes of inserting a photo, we need it unticked so it's all clear. So instead of entering something into the grey box, we want to have this clear so we can sort of muck about with this white box. All we're going to do next is insert and then let's find pictures, and we know that we've saved it to our desktop. So if you want to save it somewhere else, as long as you remember where it is, that's absolutely fine. Desktop, and here, the reason why we know it's the right patient, we've got Mickey Mouse, test patient, and then the date that it was taken and who by. So this is definitely the photo that I've taken because it was on today's date of recording and by me. So we hit insert, and there we have it. What we can do as well, once we've got the pitch format, often it will come up in the wrong orientation, just go along the top, rotate it by right degree. Sometimes it sort of just flicks around there. Okay. Obviously, then we can then add, say if we've got multiple moles, we could put this as mole 1 or something like that. Okay. And once we've done, make sure you click Save Final Version, and then that is it. Done. So, a nice simple way of dealing with dermoscopy in practice, and also how to sort of capture all this information quite quickly. As you can see, it does add extra effort, but just with I hope you found this useful just for a couple of tips and tricks and what we've done in practice, just try and make things a bit smoother. Obviously, for confidentiality, I've blurred a couple of things out. Okay, so when you actually go on System 1, they should be clearer, i.e. the mobile phone numbers. Any problems, just send me a task, drop me a line, come knocking on my door, and we can have a chat through. Many thanks.